So in this video, now we will start discussing some of the, causes which are under our control, something that we can control. So this is going to be very significant for all of us. Let us begin with the inappropriate use of antimicrobial agents. Okay. So let us understand what are the aspects associated with this. The first thing is misuse of antimicrobial agents. Now, what do we exactly mean by misuse here? Many a times this happens, that we have a fever and we just pick up some medication which was given to us when we were experiencing some kind of infection earlier, and we just consume it because it worked the best for us last time, so we end up consuming it. But are we really suffering from an infection here? Should be the first question that we should ask before we end up consuming that medication. What is the cause of the fever? Is it really an infection? So we should not consume antibiotics or any antimicrobial agent when it is not really needed, which is one of the biggest problem which is leading to antimicrobial resistance, because you are giving unnecessary exposure of antibiotics or antimicrobial agents to microorganisms, and you are raising a question on their existence. And when you raise a question on their existence, when you expose them to that struggle, that challenge, they will find a way out. And that way out is gaining some mechanism to get resistance. Another thing, that happened very, very frequently during epidemics, during pandemic, is undue prophylactic use. Prophylactic means prevention. So to prevent something, you start taking antimicrobial agents. Now, this is not really needed unless you are in a situation wherein you are prone to get an epidemic, or prone to get an infection due to an ongoing epidemic. So unless the doctor tells you that you have come in contact with a person who is suffering from an infection and you are prone to getting it, so you should then consume the antimicrobial agent. Not because it's in the media, you're being told that you should consume this, you will not get the infection, so just have it randomly. That is not how it works. It's an undue use which may not be really necessary. You are increasing the exposure of these antimicrobial agents and giving microorganisms a chance to develop resistance. Then comes overuse. Many people end up consuming antimicrobial agents even after the time that has been prescribed to them. Okay, so people go on consuming it even beyond the time when it is not needed, increased chance of exposure. Another thing is self-medication. Biggest problem. So, there are two aspects to self-medication. Number one, the doctor tells you that you have to consume the medication for 2 weeks. You think that, okay, in 1 week I feel so much better. Why should I consume the medication for 2 weeks? And you stop the medication. You self-decided it. That is one of the biggest problems. Not completing a dosage, not completing a course as prescribed. Both is a problem. Overdue of it and not completing the course. Both are equally problematic and give rise to AMR. Another aspect is that you self-medicate in the sense wherein you decide which antibiotics to consume. That is not agreeable. The doctor is trained to prescribe you medications by looking at your signs and symptoms and deciding what antimicrobial agent should be prescribed to you is the call of the physician. We are not doctors. We use, the medications that we know of, we use them rampantly without a proper prescription because we were prescribed, that medication once upon a time, and we feel that, we can use it and we will get over the symptoms that we are facing right now. And this is where over-the-counter medication comes into the picture, because we just go with a prescription, we show the prescription and we get the medication, even if that prescription was probably prescribed to you like 3 months ago, for a condition which was prevalent then and it is not valid now. Or many a times you just name the medication. This happens in our country wherein we just name the medication and it is given out to us. But is it really necessary to consume that medication right now is a big question that we should ask ourselves. This is where inappropriate use of medication comes into the picture, and I want you to look at this general prescription wherein we have to understand that a prescription needs to have the patient details, the name of the patient, the age of the patient, the gender of the patient, who is prescribing the medication. Everything should be there. What is the medication? What dosage is it? How many times you have to consume it? How long you have to consume it? All this has to be the part of the prescription. But along with this, it is very important to have an expiry date to the prescription, wherein it is written this medication should be consumed only for 2 weeks from the date of prescription. So the medical shop owner or the pharmacist should not give that medication beyond that time point, or a specific expiry date is printed that these many days this prescription is valid. If you need to take that medication again, go back to the doctor, go back to your physician, get a fresh prescription, and then you can prescribe those medications. This is becoming crucial. This is important. We cannot have over-the-counter medication anymore, because that is contributing to antimicrobial resistance, and there will be a scenario wherein you will not have a single medication which will be effective to treat the infection that you are going through. So we have to have these restrictions now. We have to understand the significance of this, how much ever it may cause an inconvenience to us in terms of going to the physician, getting a new prescription every time, but that is going to be much better than running out of medications and having nothing to treat the condition that we are suffering from. So this is quite significant for us to understand. In the next video, we will speak about more such causes of antimicrobial resistance. Till then, stay tuned.